Welcome to the Inspyre Effect.
Together we're going to unlock a path to a healthier pain for you.
My name is Leanne.
My name is McKaylee. And today...
In general, we are here to talk to you guys about things that affect you and your life and things that we're really good at doing and how we're going to help you with that. So today's podcast is we're going to talk about...
trigger point therapy.
Yes, it's one of my passions, and McKaylee knows a lot about it because she works with me. So she's going to kind of feed me some questions, and we're going to talk about it, and then kind of see where it goes. Does that sound good?
Yeah. Okay, I guess the first question would be, what is trigger point therapy? It's like the number one question. Nobody really knows what exactly regenerative medicine is or trigger point therapy. So what is trigger point therapy?
Very good. So regenerative medicine as a whole is just using different therapies to help your body heal itself. One of the most common things that we do and that I'm really passionate about is trigger point therapy. As a nurse practitioner, there's some things that I can do to kind of help improve the responses, but people want to know like what is a trigger point and how do you treat it? So we'll talk about that first, okay? So a trigger point is basically, people call them knots. You got knots in your shoulders, you got knots in your back. People say that all the time. Or I carry my stress in my shoulders. And so they go to get a massage and it feels good for a little while. And because those knots are able to relax a little bit and relieve some of the tension in that area. So that's a trigger point, basically what it is. You have different kinds of trigger points. You have acute and latent. So acute means it just happened, it just started, I didn't know it was there, it wasn't there before kind of thing. Latent is usually what we see is like, I'm not really having a lot of pain right now, but I'm always tight, or it flares up every now and then. So those are different types of trigger points.
And how do trigger points generally form? Is it more over time, just bam, like how you pull a muscle?
Yeah, so, well, yes and no. Like it's both of those. So most commonly you've heard of whiplash. You're in a car wreck. Even if it's only 20 miles an hour, it doesn't even have to be a lot. But your torso is fixed with the seatbelt. You hit something that causes the vehicle to stop, but nothing's holding your head back, and so your head slings forward. When it does that, it slings forward and back. Sometimes you can hit your head on things, so that's another issue. But if we're talking about just the neck muscles in general, when those fibers are stretched like that, they're ripped and called micro tears in there, okay? Sometimes they're really, really bad, but most of the time it's micro tears. So you come back, and then as your body is healing those micro tears, that's where you get the neck pain, stiffness, soreness, things like that, okay? So that's why you see a lot of people going after car wrecks to get some help because they're in a lot of pain, and it's usually a day or two afterwards that it feels the worst. So that's kind of an acute situation. Another example of an acute situation is people who play sports. Football players, softball players, everything else, those very physical sports can cause the same type of injury. So there's that. And then we have the most common for everybody is postural. So, or, even repetitive. So as we're fixing our posture. So sitting in a desk all day long, kind of punched over like this. Repetitive motion. So my guys that are working on houses and, using that same shoulder all the time, or whatever job it is that you're doing that requires that repetitive motion, can cause a buildup of trigger points.
What?
She already knows everything there is to know about trigger points, so
No.
she's trying to think of a question.
Absolutely not. I just know my experiences with them and like my treatments. I would say a good question is, we've talked about how they form and what they are. What would like the therapy for those be? Like, what is trigger point injection therapy? Like, what is the treatment?
Okay, so there's many ways to treat a trigger point. A massage therapist can get into deep tissue and kind of help relieve that knot, especially if they're trained in like sports massage, like our Millie, really good at it. But sports massage, basically you take those knots, you identify them, you pin them down, and you take the muscle through the range of motion, kind of stretching and trying to get those scar tissue that's holding it like there to release. Physical therapy helps, doing corrective exercises to help strengthen the muscles that need to be strengthened and stretch the muscles that need to be stretched, creating that balance. Those are all great ways to do it. But they take time. Over time this happens, especially if you're not doing anything to change what caused it. So as a medical provider, I do trigger point injections. Some people don't love the needles, so we can do it without it. But it's a combination of like a needle, a thumb, and an elbow. I'm just saying. So no, I'm not a massage therapist, but what we do is we use the needle to go into the trigger point. So for example, if you have one on your neck and your shoulder, right in this area, your neck shoulder area, what I would do is use a very small needle, the same size as an acupuncture needle, and just kind of find the knot, stick it in there, and then I inject lidocaine. Lidocaine is the same thing they use at the dentist when you go, but you're not gonna feel numb like you went to the dentist and you can't eat anything for 5 hours. It doesn't work like that. It's a very small amount that I use, and really the therapeutic part is the actual needle itself. So the needle causes micro trauma to that area. That whenever you have an injury, your brain is signaled to send healing factors. So it sends the healing factors to that area because now there's a new injury, right? Your body is so amazing that not only does it repair the damaged tissue, but it also helps clear away the scar tissue or the muscle fascia like this bunched up like that. Kind of helps loosen everything up. So think of it as like a meat tenderizer. So if we can loosen that up, and then we use the combination of therapy with my thumbs or elbows or whatever's appropriate, my knee, just kidding. Maybe, but to kind of break that up, and then moving the body or the muscle through that range of motion, getting it to release. So that's kind of what that's about. So people like to call it a concentrated deep tissue. I'm not here to massage your whole body and relax you. That's not my job. My job is to relieve your discomfort and break up those trigger points. And so we can do, for the people that are afraid of needles, we can do the same technique. We just don't do the injection. I still do the applied therapy, things like that. We also use things like cupping and scraping and dry needling, all those things to help with those as well.
It's an experience.
It is. Why don't you tell us about your experience with it?
Okay. I think my biggest point is consistency, because even though I work here, don't get it done as consistent as I should. So I feel like I get flare-ups from just sitting typing all day, or after I work out. I feel like that's when I get really tight. But my experience specifically with Leanne's thumbs and elbows and injections, but I think my experience overall has been good. It's definitely helped a lot. I came from a different job before this where I was consistently swinging a sledgehammer over my head, and without proper stretching and proper form, I've really tightened and just, I can't curse on here, messed up my my back and my shoulders, and like right under, she knows the technical terms, my shoulder blades. So getting those injections has really helped ease those muscles back into a good place. I still feel like I have little tinier knots that I do get massages for and things like that. But I think the injection, everyone's so scared of needles, but it's not bad. And I'm not scared of needles, I just don't want to watch you do it. But it's not bad at all. It definitely helps, and it's not a numbing feeling. It's more, I don't want to say cooling sensation, but like when this is the sensation you get when like you're cooling something, it's like that sensation, but without the cold. Does that make sense?
No, it does not make sense, and she's the only person I've heard. No, we're not cutting. We're not editing this. So, but I'm just saying the whole point is that everybody describes their pain and their experience differently. Mm-hmm. I think the most important to come away with that most important point is that needles sound scary, and I'm not going into your back as in your spine or your joint. It's in the muscle. Just like you go get a vaccine or you get a shot for pain, whatever it is, it's not any different than that. So I think it's really hard to get people in here, to get them to experience it, because they let the needle deter them. Yeah. Okay. And so the same thing with the experience afterwards. I've never heard it explained like that, but everybody's different. And that's where it's really important for me to evaluate you and talk to you, because I don't know that you need trigger points. You say you have, knots, but let me feel you out first. We do the not feel you up, feel you out. I guess it's kind of the same thing, but there's an extra fee for that. No, I'm just kidding. Anyways, so I bring you in and we do a good physical exam and really look at what's going on there. And if you need trigger point therapy, I'll talk you through it, teach you what it's about, what to expect as we go through. And the first time, you might be a little nervous, but then after that, when you realize how comfortable it makes you or how much better it feels, you're kind of good. And you're like, when are we going to do the next one? I do want to say, you mentioned something about consistency. Trigger point therapy is not something that you should have to be consistent with for a long time. Trigger point therapy is the fix to your problem. I say the partial fix to your problem. I can loosen it up, but what you need to be consistent with is your rehab exercises. So that's the issue, is getting people to fix their ergonomics, like at their desk. You need to stay, whatever, and I can help you with that, identifying what you do for a living and how we can keep these things from coming back. But as we all do, we're all gonna either work at a desk or we're working hard doing CrossFit or whatever it is, we're working out side with construction. Sometimes we can't change what we do, so we have to strengthen our body and prepare properly. And that's the whole fix, okay? Everybody's probably, there's gonna be times and months are worse than others, and we may get you feeling better and you have no more neck pain for a while, and then you sleep the wrong way or you sneeze or you something, and all of a sudden you can't move your neck, and then you come and see me. That's where we fix that.
Can you do that again?
No, that's something. All of a sudden you can't move your neck, and you do something. All of a sudden you can't move your neck. But that's what I think. I love that you have that experience, but it is an ongoing process because you're still doing the same thing you're not, because you're not doing that other job, but you're still sitting and you're still sleeping. Exactly. How do you sleep?
On my stomach.
So you sleep on your stomach with your arms up like this?
Skydiving position that everybody hates, and I see all the TikTok doctors being like, "That's so bad for you." I'm aware.
Yeah.
I don't care. It's the most comfortable position.
Well, sleep is super important in healing, and so you have to be in a position that'll help you sleep so that you can recover well. But then there's also understanding that choice that you're making to sleep that way, consciously or subconsciously, is contributing to your problem. So that's why we have to work even harder to kind of get it back to normal, or whatever your normal is, right?
Yeah.
So what is normal? Like, some people just live with pain. They're used to it all the time.
Like you said, you asked me the other day after my last session, do you feel loose? And I was like, I don't know what loose is, because I'm always like this. Or when we were running, you were like, you run so tensively, like relax your shoulders. And I'm like, this feels so weird to run with my shoulders like relaxed.
Yeah.
So I guess normal is just what feels good for some people.
And sometimes it's not even feeling good, it's just what you're used to. So let's talk about we're gonna kind of segue off to something else while we're talking about it, is when you are talking about your posture and you're feeling, I hear this all the time, it's just like, I don't know, I just pay attention, all of a sudden I realize my shoulders are earrings, we don't want that. But that takes some conscious effort to move down and kind of sit the right way. But that's where strength training and muscle balance and getting someone to show you the right exercises to correct that kind of imbalance will make it over time. Before you know it, you won't be doing that anymore. Like, I don't even sit in regular chairs anymore. I'm always in a stool or standing because my posture was so bad while I'm sitting. And now I've trained myself. My posturing in my body has definitely significantly improved because doing the exercises and practicing doing those things. So when you're talking about running, yes, the more you're like this, the more shoulder and neck pain you're going to have from running. Who would have thought, right? That also could be a glute weakness and other things going on. So that is, where physical therapy really comes in. So if you have something that really affects your quality of life and what you're trying to do, we're not ever going to be perfect. None of us were made perfectly. Like, we're all kind of different versions of the same machine, right? And so we're all supposed to work a certain way, but some of us got different parts, or the alignment's different or whatever. But I'm just saying that you have to feel good with the body that you have, and that is what we try to do.
Yeah.
So what other questions? We talked about trigger points and what they are, what the procedure's like. I can't think of anything else that people would want to know about trigger points.
I think it's just the overall knowledge of what they are. Like, we had a guy come in yesterday who works in the building, was interested in the gym, but he that's the only thing he knew about. So I was like, yeah, we specialize in regenerative medicine. He was like, don't know what that is. So I was like, oh, okay, well, it's X, Y, and Z. And then you get into the little specifics of PRP and trigger points and what those are. And it's like the light bulb moment. He's like, that's what all of that is. And that's what that means. So I think it's just like a case-by-case basis of who knows what and how to educate people better on what they know.
Yeah. I think that's important too, and why we're doing this podcast, right, is because there are so many things involved in helping people feel better so they can live better, right? We want you to move better. We want you to eat better. We want you to sleep better. And there's so many components to that some people walk in the door and they don't know what they need. Mm-hmm. Well, that's our job to figure that out. So through the podcast, we'll talk about the different things that we offer and kind of what that is. So you have a little bit more information, and maybe that will help guide you on if we're, the right place for you. But the other thing is, you don't have to decide. You can just come see me. We can talk about what your problems are, what's affecting your life, and I can help guide you through that. So you don't have to make that decision. So I think that's the biggest thing to come away from this podcast with.
Yeah, because I think there's so many different medicines out there in the world that we offer a specific kind of field of medicine for general health and wellness. Mm-hmm. And that's what we specialize in because it's what we feel is going to do the most good.
Just spurred a thought for me. And of course, this is something I live and breathe, and it's my brain, right? So I don't think to verbalize it sometimes. But I want to talk specifically to people who have been told that there's really nothing to be done, or the only option is surgery, or here, just take these medications, it'll help you. Just take an anti-inflammatory every day, or even worse, an addicting pain medication. There are so many parts of your life that medicines and surgeries can really screw up, and it just creates this compound, this multiple problem. So I've had a person who's come in here, well, I say patients before, but one specifically I'm thinking of. She was told she had already had surgery on the spine, and was told, and her neck pain got better for a little while, but then it got worse again. And then she was told that there's nothing to do. They're just going to have to fuse the rest of her cervical neck. Well, she already lost range of motion because once you fuse the neck, you really can't move it. You don't have the movement that you would normally have. So you limit that, and the more you limit your movement, the worse the joints above and below, or the vertebrae above and below, get. So she was told that was her only option. Well, she came in to see me, and I did an exam, and she, understandably so, her whole neck and shoulders and upper body were just so tight. And so there's some things, I can't fix a fused neck, obviously, but those muscles. So we worked on we did trigger points on her, and we did some corrective exercises. And about 3 sessions in, I didn't hear from her. It was like, why hasn't she rescheduled? And I called her back, and she says, oh, because I don't need you anymore. I don't have any more pain. I was really stunned and surprised because I didn't see it going that direction. So, and that's happened a couple of times. So now I try to follow up a little bit closer to find out see how they're doing. But I'm just saying that there's an alternative to surgeries. There's an alternative to taking daily medications. And that's really what I want to push.
And I feel like that's exactly the go-to line for regenerative medicine is alternate
options.
Thank you.
Yeah.
I can't think of
brain
words.
farts.
Yeah, today.
I can't help brain farts. So I can help neck pain, not brain farts. But
got it. I'm just a lost cause.
No, you're not. You're okay. We just need either more or less caffeine, one or the other.
Less.
Yeah.
Sorry. I've had way too much caffeine. I did not need that coffee.
I'm glad I didn't put your extra shot in there.
Extra shot?
I didn't get it. I put one in mine. I said just in one of them, please.
Yeah.
I don't think she can handle it.
No.
So we've talked a lot about trigger points like in the upper body, but that's not the only place that it can be. Usually, trigger points, if you got a muscle, you can have a trigger point. So it could be in your thighs, in your calves, it can be in your glutes, your butt muscles, all that stuff.
Do you see them in the fingers and the feet at all?
In the feet, yes. I have not in the fingers. I have seen them in more of the wrists and in the hands, and the webbing of the hands like that. Yes, I have actually. But if you got a muscle, in jaws, I did a trigger point release on a patient the other day in her jaw, and she almost cried because she's like, I don't know why this hurts so bad. She didn't know that she has TMJ disorder, and so she would clench and grind and just had this huge knot right here. So I just did a little tiny bit of dry needling right on her jaw, and then just used my thumbs,
Maybe that's
these
what
dangerous
I need.
thumbs, to get in there. Ask my husband; he hates my thumbs.
My TMJ's been acting up like the last couple times I've been eating. It's been popping really bad, and you can feel the muscles right here. I never knew that I could get something done for my jaw like that.
And then clenching and grinding your teeth, you muscles kind of wrap all around your head this way. So my friends that have chronic headaches, they wake up in the morning with a headache and a stiff neck. If you have TMJ and you're clenching and grinding, you have all these muscle tightness. Now, I can't fix the way your jaw lines up. You'll still need to see your dentist about getting a night block to kind of keep from grinding. But those muscles, when they're tight like that, they can cause all those issues, and we can fix that. We can fix
Maybe
that.
that's where we need to go with my treatment.
Yep. There you go. Another treatment.
Look, learn more every day in our work here.
But talking about everywhere, one of the other so I would say upper body is probably where I see the most trigger points, or people complain about them the most. For lower back pain. Usually when I hear people complain and I find trigger points, they've had chronic low back pain. And what I hear is, I didn't do anything. I just bent over one day, or I sneezed the wrong way. I know I've said that a couple times, but that's really a thing. Sneezing is dangerous for the body. Like, seriously, you could really injure yourself, and the older you get, the worse it gets.
The louder they get too.
The louder they get, yes. But you develop these, anywhere you have an imbalance or an injury, you can develop trigger points. And so if you think about it, our posture and sitting in our cars for long periods, sitting at our desks for long periods, just the things that we do, just picking up stuff off the floor, it can really strain the back. And our muscles, our brain protects the spine with our muscles. So when you have an injury like a disc injury or anything like that, when you injure, that's why the muscles tighten up, is because they're protecting you to keep it from getting worse. But over time, even when that disc injury is healed, or whatever the injury initial cause was, there's so much scar tissue, and it's just holding the muscles in place, and they can't go back to their normal length, and that's going to create pain. So for example, in your glute muscle right here is the most common, right up top. Really, really tight. It's attached to your hip. It's attached to your lower butt. It's attached to your back right here. Sorry, I'm all out of the picture. Put my butt in there. But I'm just saying. But that tightness in the glutes keeps the glutes from being as strong as they can be. And so whenever you have weak glutes, usually, and because we're sitting a lot, we also have short hip flexors. And so we've just created this perfect storm of things that are pulling and creating muscle imbalances in your lower back. So with that being said, I don't know where I was going with that, but basically trigger points are everywhere. We commonly see them in the lower back, and this elbow is great for those.
Okay, now side question. You talked about scar tissue. Does scar tissue always form in places like that? Or, I don't know, I guess, me personally, I don't know a lot about scar tissue and like what it does, how it forms. Is that something that we can do trigger points on? Or is that like help me out here, I'm just lost.
So scar tissue, I think, is more when you don't rehab yourself the right way. So you have an injury, or chronic position issues, that's going to be just kind of shortening of the muscles. So we have a couple different things. One is, if you injure yourself, you rip the muscle fibers. As the muscle fibers heal, sometimes they can adhere or get stuck together, or get stuck to the fascia that's wrapped around them. So if a muscle fiber, I always go to mechanic or food. So I'm gonna help make this analogy about food. Sausage. You have your meat, and then you have the sausage casing, right? The casing is, think of it as like your muscle fascia. So whenever we talk about fascia, it's basically, that's all it is that thin layer of membrane that is just holding the muscles together. And then each one of those muscle fibers is a bundle of muscle fibers, and each one of those is interlaced and overall wrapped in more fascia. So when we have an injury, we rip the muscle fibers, but guess what else gets damaged? The fascia. And if you don't recover properly, meaning if it heals and has time and it heals in that shortened position, the fascia basically kind of gets glued together and your body is deposited. It just gets stuck. So that's where we can't like straighten our muscles back out, and we have to loosen up that fascia or the scar tissue that's holding it in there and let it go. Okay, so that is one thing. That's going to be a little more like injuries and things like that. If we think about athletes working out, when you're lifting or when you're doing things to get stronger, your muscle fibers are tearing. If you don't recover properly, so this is what people don't do, is they don't take the time to recover after their exercises. They don't use the foam rollers or the massage guns. There's so many different things, and we can help you decide what is best for you, because depending on what your sport is it can tailor how you need to recover. But again, you recover enough, it's important to keep that fascia from getting stuck together as your muscles are healing. So that's another kind of example. So there's not much scar tissue there. It's more about the fascia just kind of getting adheres to the muscle fibers and not letting them work like they're supposed to work. Am I boring you?
No, sorry.
Man, she says she's had too much caffeine and she's yawning. I must be boring her. But but that's a good question, is like specific, like an injury versus kind of like repeat day-to-day things that we're doing. But also for trigger points, we talked about trigger points can be anywhere. They are muscle fibers that are just kind of like stuck in this position for whatever reason. So we break up the scar tissue or the fascia, letting the muscle go back to normal. Then we have to retrain that muscle. So muscle fibers kind of shorten and they get trained to stay like that. So even if we've gotten rid of some of the fascia, or not gotten rid of the fascia, but the adhesiveness that's keeping it stuck together, we need to retrain those muscles. And how do you do that?
Your rehab exercises.
Yeah, I need you to say it with a little bit more smiley face.
Sorry.
Rehab exercises. So a lot of people do have that same feeling. It's like, oh, I don't want to do rehab. Well, let's not think about it as rehab. We're just thinking about it as, I don't want to feel like this anymore, so I need to do a little extra work. Right? And so with the trigger point therapy, with massage therapy, we all have some basic corrective exercises we can help you with. But with the chiropractic and the physical therapist, that's where you get most of your corrective exercise. They can really see you in the form, what you're doing, and help you identify those muscle imbalances and correct those specifically. You won't have to do it for forever, but it does take some commitment and some consistency. But if you want to feel better fast, trigger point therapy and injections is the way to go.
I guess the kind of only thing we haven't gone over is is it the technical term, your trigger points are healed per se, but like once you go through that therapy, like what are the after steps? Like once you're feeling better, you've done your exercises, you've corrected the problem, what does a day-to-day life kind of look like after the fact?
That's a pretty good question. So if your issue is caused by an injury, obviously the goal is to not get injured again, right? But most of the time it's a postural thing. So many of us now are living in a world where we're like this on our phones or our computer, and so our muscles are just getting trained to be shorter in the front, weaker in the back.
Hump back.
Yeah.
Sorry.
But once we're able to restore the function of those particular muscles where their trigger points are, and we have corrected that imbalance through exercise, your job is just to maintain that. So your postural exercises, and really we should all be exercising regularly. We don't all have to do CrossFit, on a regular basis, or running a marathon, but some kind of physical activity, getting up. If it's a postural issue, then my goal through your treatment plan is going to be to get you sitting better, understanding where your computer needs to be in order to minimize the issues with the trigger points. How are you going to have a podcast and organize it, but not turn your phone off?
Hey!
So after your treatment plan is done and you're feeling better, the plan is for you to not put yourself back into the position you're in. Obviously, you're injured, sometimes you can help that. But the other thing is postural stuff like ergonomics at work, hopefully the program we help identify ways that you should be sitting and standing, or your computer should be adjusted to help minimize postural issues. And the other things that you should all be routine exercising. So it doesn't have to be CrossFit running a marathon, it just has to be moving. So the majority of us that are at our desk, we need to move more, and so we work that into our plan, and that'll minimize the reformance of or resurgence of your trigger points. If you have a job where you are very active, your body's used to that, making sure that your form through that activity is correct. So if we're talking about you slinging the sledgehammer, people can do physical work like that and not have any pain, because they know how to use their body to get the most power, right? With the least amount of effort and the least amount of injury. And that's what we do, is take your lifestyle and figure out how can we help you do the things that you need to do to not only recover, but keep it from happening again.
Good, very good. Are there any common myths about trigger point therapy that you could think of? Like, what do most people kind of tell you that you're like, wrong?
Really nothing, because nobody really knows what the hell they are. Like they think, I say the most common when we talk about, let's say most common myths, not about trigger point specifically, but about neck pain or back pain, right? The most common things is like, there's nothing I can do about it, you know, or whenever I was younger, I was an athlete and I tore my body up, and so now I have to live with it, yes. Or the other thing is like, oh, my left knee hurts so bad, they say I need to have a replacement just because I'm getting old. And I'm like, well, both of your knees are the same age. So if that, I mean, unless you've already had a replacement, they're both the same age.
Unless one leg came out the womb before the other leg.
Okay, so now we're splitting hairs, right? But basically our bodies, everything's the same age. So if it's truly because of aging, then our whole body is affected that way, not just one particular, right, joint. So that is usually, and the other myth, and now we're talking about it, is your knee pain is, unless you've had a specific injury where you're running and you're playing football or something and somebody just tackled your knee and it broke or whatever it is, most of the time our knee pain is because we have issues with our ankle or our hip mobility or even our back issues. So it's more than just looking at the knee. You go to your orthopedic or your primary care because I'm having pain in my neck or in my shoulder. But if you look at and so they do x-rays and they're like, oh, everything's normal here. We're going to send you to PT and here's some anti-inflammatories to take, right? And so you do that for a while and nothing's better, and so you just deal with it, or you go to a pain management specialist who gives you steroid injections, which are horrible for soft tissue. Like I said, they have their place, but not, you know, it shouldn't be the go-to, you know. But anyway, so we got to look at the whole thing. The majority of shoulder pain, guess where it's coming from?
Oh, look whose phone's ringing now. Look whose phone's ringing now.
It's Carnival Cruise, so I have to answer this. Hello. Just kidding. Sorry.
Carnival. When are we going on a cruise?
We're not. That's why we're not answering.
But the last one was fun.
It was fun. But anyways, so...
the majority of shoulder pain?
Yeah. The majority of shoulder pain, you want to guess what actually causes shoulder pain most of the time?
Posture? It's like everything we're talking.
Yeah, I guess so. I guess you're right. But the majority of shoulder pain is actually coming from the neck.
Oh, I did know that.
Yeah, I knew you did. I just didn't know how to ask it to where it can let the people know that you did. But usually it's because we have something going on between the neck and the shoulder, whether it's muscles, nerves, something like that, that is causing that pain, and it's radiating down the shoulder and the arm. Just like elbow pain is usually coming from the shoulder. It's crazy, but so when we go to traditional medicine, for elbow pain or shoulder pain, that's typically the only thing that we're looking at. Until maybe you get into physical therapy, then they're able to look at a bigger picture. But that's why we do this, is because we look at the whole picture. People come in and they'll ask me, we're talking about their shoulder, and I'll ask about car wrecks that they've had 15 years ago, or the sports they played when they were in high school. Well, that doesn't matter. It wasn't a big deal. I said, oh, yes, it is. It all matters.
It's always a big deal.
It always matters, because everything you've done in your life has led you up to this point right now. And if I know a little bit more about that, then I can help you not only feel better, but get you back to the things that you like. I have a patient the other day that wants to play volleyball, hurt himself playing volleyball. He's in his 40s, has always played volleyball, loves it. Hurt his back bending over and picking up a piece of paper on the floor.
Lightweight.
Yeah, but probably his injuries were from the years of playing volleyball and not recovering properly. But that piece of paper just set him over the top, right? Obviously, the paper wasn't the injury.
Yeah, right.
But, you know, I'm talking to him and I'm like, well, what is it? And his pain is just kind of nagging. It's not really, you know, not a big deal. He just has been told it's nothing. So he just thought he would come talk to me. And so I asked him, well, do you still play volleyball? He's like, oh, no, I can't. I'm too afraid to hurt my back. Bam. That's what our goal is. You want to play volleyball? If your back was not hurting you or bothering you, what would you do? I would play volleyball at least once a week. That's our goal. So that's what we're working on. So overall, just looking at the whole picture is super important. I know we're talking about trigger points, but when it's just all tied together, it really is, you know.
I think it's because the body's all tied together. It all moves as one being, one body, and it's like
because the hip bone's connected to the thigh bone. Thigh bone's connected to the knee bone. I think that's how it goes.
I did that in like the 4th grade. I don't remember. And
Well,
it's
that
been
was
even
a lot longer for me. Thanks.
I was about to say something though. That was a good song though.
But seriously, if you look at a chart, I don't have it in front of me, but any chart, if you just Google muscle fascia, we actually have a series of fascia, a connective tissue layer that tops from the top of your head. No.
Pull out the chart from the room.
No. We're not gonna. Y'all can come in if you want to see the chart, but I'm seriously, like, the things that your feet can affect your head.
Yeah.
Because we are connected. All of our muscles are just layered together, connected to bones and tendons and things like that. But then there's this layers of fascia that just connect all of them. And fascia is full of nerve fibers and lots of other things. There's so much more to be learned about fascia. It's amazing. But I'm just saying, you're right. Everything's connected to everything. And more than likely, you do not have an isolated joint injury.
Okay, random question. What would you say the most important part or structure of the body is, in your opinion? This is your opinion.
Is going to be your core muscles, your spine, your core muscles. Because if you do not have a good foundation, everything else is just kind of flopping in the wind, right?
That's like that analogy he told us, or metaphor he told us the other day. You can't build a 3-story house on a 1-story foundation.
I think it was something like that. But yes, you get
That's what
1-story foundation. Yeah. Oh, you're right. I'm
Yeah.
sorry. A foundation built for 1 story, you can't
can't
decide to
build
build a 3-story
3 stories
house
up.
on and expect it to work optimally.
Yeah.
So yeah, kind of. So the same thing is like the core, so people like think just going and working with the personal trainers that they're getting stronger. They are getting stronger. You're building muscle. You're helping create strong bones, but that's not going to strengthen your core
If you don't have the right
itself.
personal trainer, but Michael is really great. And
Yes.
you should definitely come see
Find
him.
yourself the right personal trainer, but it's all about the foundations and bringing it down. So I'm going to segue into another example as myself. So in April, I ruptured my L2 disc. So that's the lower part of my back, the second vertebrae between the second and the 13th.
Like
So-
exploded?
Basically. So when you have a disc, so you have your vertebrae, right? Each one of so there's little spine bones, we'll call them that, okay? And in between each one of those, there's little jelly cushions. And whenever they absorb impact from when we jump, we run, we move, they help the spine move, okay? If you think of those as each like little joints, they're supposed to move to be healthy. That's why being locked down and tight all the time is not healthy for our spine and creates a degenerative disc disease. So get older, it's like, oh, I have degenerative disc, because of this. You're not. It's just because everybody gets that way and it wears down over time. So it's not a special thing. So I hope I don't offend anybody by that. But but the disc itself, when you bend, for some reason, for whatever reason, it's an injury or whatever, the disc bulges out. And you've heard of bulging discs.
Yeah. And
they have different levels or different, how bad that they can be. Then that disc can actually pop. So if you think of it as like a jelly donut, it's obviously a harder jelly. But when the outside of that disc rips, the stuff comes out, right? And it eventually will come back in, but that's where rehab therapy comes in, is relieving that imbalance that caused that pressure and push that jelly out to come back in. So that's what happened to me. And so that's why I say when people say they have herniated discs, you have a history of herniated discs, meaning the disc was pushed out, and then when you relieve the pressure, the disc can go back. So depending on how bad it is how long your recovery time is, right? So when you have a ruptured disc, it takes a lot longer to heal. Average healing time for a ruptured disc is like 16 to 18 months. Okay, so April, May, June, July, August, September, October, November. No way. Did I do that right? April, May, June, July, August, September, October, November. It's already November. So 7 months out from my injury. And I thought I was doing really good, but every time I go back to exercise, like I like to, lifting weights and doing the things I like, my back flares up. And then I just decided it's because I was not dedicating the proper time to rehab like I need to. So now I've had to swallow my pride and go back, and right now my exercises only consist of those core workouts because I kept trying to advance my workout without focusing on my foundation. Yes. So now we're going back to the foundation because my goal is to be a strong old lady, right? When I get old, because I'm not old now, when I get old, I want to be strong. I don't want to be frail. I want to be able to take care of myself. I want to still be able to function and do the things that I love, and that starts with me doing that now. So like I said, swallowing my pride and leaving the deadlifts alone for a little while until I can get my core a little bit more stable, then we'll be moving forward. So I'm not sure why we're talking about that.
I just had a random question about what you thought the most important part of your body
Yes.
is, and somehow her magnificent brain tied it all back into what we were talking to.
But that's the core, really focusing on that. And people think about core, about six-pack abs, and about being skinny. It's not even that. That's the powerhouse of everything. Without a strong core, you cannot be strong overall. It just won't happen.
I like that. There was something else really random that I wanted to ask you, just because I feel like I should have asked you this a while ago, like just between us. What is the craziest injury story you've ever witnessed, dealt with? Because you've worked, if anybody didn't know this,
If anybody didn't.
that's the caffeine.
Yes.
Leanne worked like over 20 years in the ER room, but now she specializes in more of a clinical. She still works at other places, whatever. But the point is, I know she's seen some crazy. I can't curse.
You have done. This is a different type of podcast. If
Sorry.
you get to cuss, I get to cuss.
Okay, sorry. But I'm asking you this because I know in some way, shape, or form you'll be able to tie it back to what we're talking about as well. So, craziest injury you've kind of ever seen, or maybe give us like a top 5 kind of short summary.
Honestly, I don't know. I've seen so many injuries, and so most of them, okay, so car wrecks, obviously we have lots of injuries. We've seen them. I've seen somebody's foot completely flipped around the opposite direction, but they can still move it, and you can see the artery pulsing. So that was really cool. So there's that. I can't.
I'm over here gagging. You're like, that was so cool.
Yes, I know. But I saw a kid who was playing football, and I don't remember how it happened. He got hit, and his timeout. A high school student playing football, and somehow I don't remember what the specific injury was. I just remember he came in, and his kneecap was all the way up here. So whatever injury he had damaged likely the patellar tendon that holds it down, and it ripped and came up this way. So he had to go to surgery right away.
Was it in his skin, or was it popping out?
No, it was underneath.
Oh, okay.
You could just physically see the knee sticking up here, and then of course he was in a lot of pain. His leg looked deformed because I'm sure there's more injuries. But when they have major traumas like that, they don't stay down in the ER very long. We get them to the to the OR pretty quickly. But anyways, that was probably the most I've seen lots of broken bones, lots of stuff pointing different directions, sticking out, things like that. But I would have to say that would probably be the one, sports related, or something that definitely surgery is necessary for. So that's for sure.
Told y'all.
Ain't no amount of PRPs gonna fix that.
Next question is, what is your most memorable? So when I'm thinking about this in my head, who's come in with the worst pain, and your most memorable success story, trial case study thing to where you got them feeling the best?
Man.
With trigger points, PRP.
With anything?
With any regenerative medicine that we've done, or you've done.
There's been so many situations that, and I'm not saying it's because I've performed miracles.
No, yeah.
Right? But it's the fact that people love that we take the time to listen to everything and how everything just kind of fits together and we address the whole problem. So I see that a lot, and people are like, oh my God, I feel so much better, thank you. So I get that quite a bit, but most recently was honestly just because it just happened the other day, was the TMJ lady. She came in and she was in so much pain, and initially I thought that she must have a really bad sinus infection or an infection in the ear that's maybe even gone to the bone and some other things. We always think worst case scenario. Well, I do. I think worst case scenario just because of how I was trained in medicine, but when I was doing my exam, and this is why it's important to listen to the whole thing and start to really ask questions and do things, is I just felt around and I felt that she had that knot, and I just put a little pressure there, and I had her open her jaw while I was holding pressure, and she literally went, oh, and then I let go. She said, do it again. So I put it on there, and she opened and closed her jaw. She said, oh my God. And so I love those moments when people think they're basically about to die. Like, this is so terrible. Some people are dramatic, more than dramatic than others. But she just literally was like, I don't know what this could be. I don't know what's wrong. And then just a simple application of pressure to let her realize it's not that big of a deal. I love that kind of stuff. So there's lots of other things I'm sure I'll think of when we're done here, but that's the first one that pops up to my head.
Good, very nice.
One other story that I'm thinking about, and I like these because they're outliers and because this shows how like things that we do in our life are so important. Like, not everybody's the same. We don't do the same thing. We're not built the same way. But a lady came to me. I met her at a marketing event we went to, and she's like, what is this? And she comes over and talks to me and start talking about trigger points. And she's like, oh yeah, I always have this pain in my neck. And so I did a quick little mini exam, and she's like, oh yeah, I need to come see you. So she comes in, we do a treatment. I found out that the reason why she has neck pain is because when she's in the car, she lets her 60-pound dog sit on her shoulders. She carries her 60-pound dog around on her shoulders. He's in the car, he sits. She just loves that dog so much that there was no way that I could tell her, you can't let the dog sit on your shoulders, right? You can't do that. And people would say, oh, you have neck pain because your dog sits on you? Well, don't let your dog sit on you. And she's like, I would rather deal with the pain. She loved her dog so much. So we helped work on her pain. We did some corrective exercises and strengthened her back. Now the dog rides and she's pain-free. So I'm just saying, we can do weird things.
That's crazy.
Together.
For an extra charge. Okay.
Anything else?
Well, if y'all have any questions, please let us know, because we would love to answer some of those in fun, lighthearted, educational ways. I feel like we haven't gotten a lot of feedback, and we would love some. I think it's important for us as I give her the feedback because she's a professional and I am at your service.
Oh
but I don't have that education, so I like these kind of sessions that we have, these podcasts, because I feel like I give her the input of the regular person, the questions.
Well, I think too, when we try, if you have the luxury of being one of the 11 people that saw our first podcast, I think that we realized quickly that while we're trying to use the podcast to educate about what we do, scripting and stuff like that is just not our jam, right? It's just not. So the approach for this one, I hope, is going to be better. It's just us being ourselves. I don't know how she's going to edit it, what she's going to take out or not take out, but I think
we weren't editing anything.
Oh, really? Okay, well, we'll see. But I feel like that this is us, and this is what you'll get at Inspyre, and I think that's important, and that's the feedback that I've gotten over the years, is that it's different than when they go to the regular providers, because I think of that reason. So you're like family, so together we're going to work to help you feel better
and live better.
See you later. Very good. Very good. Whatever.
Very good.